doctors. Hi, doctors. I hope that you are all okay. We are about to start, so who's ready to go? Today we have a very important session because some of the stations are new and unfortunately not easy. Anybody ready to go?
Dr. Hello, Dr. Hussam.
Hello.
Can I first?
Yes,
Because I
yes, no
have
problem. So what is your station, doctor?
psychosis.
Prodromal psychosis?
Yes, prodromal psychosis.
Okay, 1 minute. Okay, here it is.
Okay.
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 1 minute. Let's say that my name is Mr. White and the patient's name is Anne.
Name what? Patient name what?
Anne.
Anne.
Yes.
Anne. Right. Okay.
Okay. Start the timer.
Yes.
One, two, three, go.
Yeah. Hello, Mr. White.
Hello, doctor.
I am Dr. Hassan from the mental health unit. I
No.
understand that you have some concern about the condition of your daughter, Anne. And I am here to listen to you and to answer your concern.
Yes. I've discussed this with the GP. He asked me to talk with you. And if you have anything regarding her management, I would like to know more about it, please.
Yeah. Mr. White, I understand. I can imagine your feeling. You are a father. Rest assured, I will do my best to help you. To help
Yeah.
her in the best way, I would like to ask you some questions. Is it okay?
Okay, no problem.
Yeah. What your understanding of her condition, Mr. White?
Well, it has changed lately. A lot. Even her grades has declined dramatically. Keep saying that her friends are talking about her. And I don't know how can we sort this out.
What?
I don't know how can we sort this out.
Yeah. Mr. White, I'd like to know more about her life circumstances. Any stressor around her recently?
No.
Yeah. Anyone around to support her?
Yes, we are all trying to help her.
Yeah. Do you have any family history of psychiatric problem?
No.
Yeah. Do you have any concern about her safety?
Well, I don't know, doctor. I don't know. I'm worried that she might hurt herself.
Yeah. Mr. White, an experience what is called early onset psychosis. Have you ever heard about it before?
No, what is this early psychosis? Early onset
Yeah.
psychosis. What is psychosis? I don't know.
Yeah, I will explain it to you. Psychosis is detaching or splitting from the reality, and also and have some strong false belief that her friend talking about her behind her back without any evidence, and we will call this delusion.
Yes, yes, yes.
Yeah,
And what can be the cause for this?
yeah, many no particular causes, but many factors can contribute in this condition. Like a change of some chemical in the brain, if there is any past history of psychiatric problem, if taking any illicit drug, and
Yeah,
also if there is any family history
I see.
of psychiatric problem.
Could be there any other possibility other than this diagnosis?
Yeah, yes. Might be secondary to taking of illicit drug, or might be secondary to the depression. We will exclude or confirm that.
Well,
Don't worry.
do you feel that she might be better? Will she
We will
get
hope
better?
we will hope that, Mr. White. But and the good news that we detect this condition early, and we will start her treatment management email early, and also he have some positive symptoms of this psychosis, and it is more manageable than other negative symptoms that she not experience. Don't worry about that.
Okay, doctor. So how can you help her then?
Yeah. Before going through how we can help her, I will summarize the most important point to focus on in our management. First of all, she experienced early onset psychosis with the low risk level, and also in the background that have good family support and no any past history of psychiatric or physical problem.
I see.
First of all, I would like to see her again to assess her more, assess her physical and mental health more, and to go through the risk assessment. And we will work as the one team to cover all her needs, physical, psychological, and social. How do you feel about that?
Well, it sounds helpful, yes.
Yeah. Also, we will go to make for her some blood tests like kidney function test, liver function test, CBC, and heart racing, to make sure that she is fit to take her medication and to exclude any other physical problem. Is it clear, Mr. Wyatt?
Yes, okay.
Yeah. If we find any physical problem, we will contact the physician. According to her psychological problem, we will give her some medication like aripiprazole. And after her condition is improved to some extent, we will contact her with the psychotherapist for some talking therapy. Is it clear?
Yes.
You have any other question? Can I continue?
Yes, go ahead.
Yeah, according to also we will socially there is the social services which can contact her school to make sure that the duration of her management not affect her education.
Very good.
Yeah. Also we will we will see more and assess her more if she taking any drug misuse. We will contact her with the drug and alcohol misuse team to help her.
This is very helpful.
What?
Very helpful.
Yeah. Okay. Do you have any other question, Mr. Wyatt?
No, thank you. 1 minute maybe.
Yeah. Thank you for your discussion with me, Mr. White. I will give you a leaflet about all what we have discussed, and don't hesitate to contact us if you have any concern about your daughter.
Very good. How do you feel about what you did? You're very clever, but there are some points which you should pay attention to. I will discuss it.
But the voice, what?
You are very clever, but there are some points which I will discuss with you. Please, dear doctors, if you have any feedback for our dear colleague, please send your feedback on the channel if you don't mind. Okay, so please, your language, it's not about the content, but it's about how you talk. It seems that your language needs to be improved. And it's not a matter of going to take courses in English language. definitely you have your own notes, and definitely you have your own source. Just make sure that you mention the sentence which is written in the sources, because your language sometimes is not good in the communication. Unfortunately, there are 2 points in the mark sheet related to the language, and if you miss them, there is no good chance that you pass.
Yeah.
When I ask you whether she's going to get better, this is as I said, it is a very common question. It challenges your knowledge about the prognostic factors of psychiatric disorders. As we know, there are some positive and there are negative, some factors which promotes the good outcome, which are so and so, and there are other factors which promote the negative outcome, like so and so. You should have elaborated better than this. Regarding the
Yeah.
formulation, very good. You mentioned the formulation in a very good way. But pay attention to the following. Is that when you do your formulation, please pay attention that you should signpost before saying it. So, for example, when I said to you, how are you going to help her? So the sentence which is supposed to be as an introduction to the formulation, to which would show that you are not answering the patient in another area, and your answer is related to his question. You can say something like, we are going to mention the main points in her condition, which we will focus in our management plan. This sentence is very important to show that your answer is related to his question, and at the same time you will say the formulation. Okay.
Okay.
Where the patient
Yeah.
is going to be treated, please don't forget this. Where the patient is going to be treated, basically this patient still her risk is low, but you don't know what will happen. So you must put in consideration that if at any point, if the risk has changed to high, the admission might be considered. Talking therapy, just mentioned CBT will take about 12 to 16 sessions, because as they said in the task, the long term. So you must mention the CBT because it is what considered to be the long term. Regarding the investigations, it is mentioned that she has used cannabis. So it is very important to mention in your investigation the urine drug screening. Very important.
I forget it. Yeah.
Okay.
Yeah.
Let's see the feedback of our colleagues. He mentioned negative and positive symptoms, but didn't it? Yeah. As I said, Dr. Kaya, where she mentioned positive and negative symptoms, but she should have elaborated more about the positive prognostic factors and the negative prognostic factors. It is not the positive and negative symptoms as much as the prognostic factors. There are factors which promote the good outcome and factors which promote the negative, and they are standard in all the psychiatric problems which we have, nearly the same. Okay, so let's see according to the notes.
Yeah, doctor, what you said about this outcome, I only explained the good things about outcome. What you said?
The prognostic factors. You don't know the prognostic factors.
Yeah, I should talk about negative and positive prognostic factor, or what?
If you just pay attention to this.
Yeah.
Okay. The negative, there are factors which favor the good outcome, early onset of the treatment, etc.
Yes.
And the absence of stressor, and also the nature of symptoms being positive, negative symptoms, and so on. So just mention the positive and negative prognostic factors, even if in this paragraph, the positive and negative factors are tailored according to the girl's condition. But you can just mention in general what are the positive and negative prognostic factors. The negative factors that if she's not engaging in the treatment, if there are stressors, poor coping with the stressors, no support around her, if there is positive family history, and if there is a medical underlying condition. Okay, so all these are considered as negative factors, and the opposite are the positive factors. Okay. So let's see This, as you can see, the task is address her concerns, talk to her, address her concerns. Okay, so most probably when this is the task, it is about the management. Because the case is already diagnosed. So here, this is your plan. You introduce yourself and pay attention to this because many candidates do not know how to do the introduction. There is simple rule for this. It is identify yourself, greet the patient by his name, and explain why are you talking to him. Candidates sometimes forget the patient's name. Sometimes they forget to say their own name, and sometimes they don't say why they are sitting with the patient or with the family member. The introduction is very important. First impressions persist. Your explanation was good. It could have been better, but all in all, it is good. Good that you started by gathering the biopsychosocial information. This is our plan. You introduce, you either explain or gather this information according to the flow of the station. Then do your formulation and finally the management. This is the stepwise approach to make sure that you are going to cover all the points in the mark sheet. So after gathering the biopsychosocial information and doing the explanation, he might ask you some questions which you have answered in a very good way. Could be there any other diagnosis? I think you mentioned the substance misuse and the depression. Second, didn't you?
Yes.
Yes, okay. Then he's going to ask you about the prognostic factors. And finally, when you reach the station of formulation, nobody is going to ask you what is the formulation, but you must say it and you must manage to put it and in your dialogue. And the best place for it is just before talking about the management, because the formulation is the foundation of the management. So in your formulation, you are going to mention the first line, which includes the main psychological diagnosis and the level of risk, and the second line, the background biopsychosocial information. Okay, and there is a clip in my YouTube about how to do a formulation. It's very simple skill, but unfortunately, most of the candidates do not know how to do it. And unfortunately, it is the very first point in the mark sheet. Then when you reach the management, pay attention that most probably you will have not more than 2 minutes maximum. So you must be very organized when you talk about the management. My approach is to start by saying, what am I going to do? What Dr. Sadia is going to do if she is the candidate? And number two, where the patient is going to be treated. So this is the best start. If there is a high risk, definitely the patient is going to be treated in the hospital. If there is low risk, he is going or she's going to be treated at home. And why I start by saying what I'm going to do? Because there is a point in the mark sheet for those candidates who are keen to discuss with their patients their diagnosis and the management, etc. So we want to score as much as we can while we are going through our dialogue with the role player. So this is the first point. What are you going to do and where the patient is going to be treated? Number two, investigations. As long as you are going to use medications, never forget that there must be some sort of blood tests. We have the basic blood tests, but sometimes the candidates forget to mention what are these blood tests. So you must specify what are the blood tests: liver functions, kidney functions, CBC, and heart tracing. You can add some blood tests according to the station. So we have here the urine drug screening. Okay, very important to mention it because in the history, it is said that she has used cannabis once. Okay, very important to mention this. The urine drug screening. So you want to know whether her blood still having this cannabis in her blood or no. Number three, you must mention, as we said, must mention the team which will cover. You must mention this sentence: there will be a team which will cover all her needs psychologically, physically and socially, to show that you are a holistic doctor, which covers all the aspects of the needs of your patient, not only symptom specific. So you have psychological problems, you have social problems, and you have physical problems. So psychologically, you are going to use a medication suitable for her age. Don't mention antipsychotics, and that's it, because we know that in the young age needs some sort of some medication are suitable for them, like aripiprazole. Okay, and then you must talk about the CBT when her mental state is stable and she's fit for this CBT. And you can mention 2 points. It will last not more than 3 to 4 months. She will take a session once every week, etc. As long as there is a substance misuse history, she must be assessed by the substance misuse team. And don't forget this sentence in social service. This will make a big difference between you and the other candidates, because you know that this is a student and her grades are deteriorating. So you must make sure that the duration of treatment is not going to affect her scholastic achievements. So the social services will communicate with the school to make sure that the period of treatment will not affect her education. And finally, terminate registration. Okay, is it clear so far? Any questions?
Okay.
So let's go to see this mark sheet, and please, whether you are going to use my notes or any other notes, please make sure that you assess yourself and you assess your colleagues according to this mark sheet, not according to your personal personal assessment. With all my respect, I'm not challenging your experiences, but it's about a game which is called the cask, and this is the rule of the game. This mark sheet is the rule of the game. So if you play with the rule, you will pass and you will score. If you don't know what are the rules, you will not pass. So the first point is to formulate. You have formulated effectively. You paid attention to these findings and results. Management plan include the biopsychosocial, as we have mentioned, the aripiprazole, the CBT, and the substance misuse team, and the social services. Everything was mentioned in it. And as you can see, the point number 4, sufficient attention to the patient's health view. You will never score this point except when you say, I'm going to talk with my patient to explain his diagnosis and address his concerns. If you don't do this and you just talk with the father as if this this patient is just a non-animated object, and she does not have any sort of mind or any sort of soul to discuss with, I don't think you are going to score this point. The risk management plan, unfortunately, you did not put in the consideration that at any point, if she has any sort of risk, she might be admitted to the hospital. So this point might not be scored for you. You did mention the social and psychological management. So this point is going to be scored. So out of 6 points, you are going to score 5. Regarding the communication, everything is good in your communication except point number 11 and 12. As you can see, these 2 points, you might feel that they are not fair, because particularly for the IMGs like us, the international medical graduates, the language is definitely not like those who are native or staying for a long time in England. But this is the rule of the game. If your language is good, you're going to score these 2 points. If your language is not good, you are not going to score these 2 points. So please pay attention to your language. Try to make sure that your language is accurate, and stick to the sentences in the notes. There's no time to improve the language. Try to stick to the sentences in the notes as much as possible. Okay, doctor, thank you so much. This is not a pass or fail, just to tell you how to use this mark sheet. Very well and very clever, Dr. Sadi, mashallah. Hope that you found it helpful. Then who would like to go next?
Can I go next?
I would like to go.
Oh, sorry.
So okay, so after Dr. Charles, if can we have a simple list in the chat section? Who would like to go after him? Please put
I
his
like
name.
it.
Okay,
Sorry.
the one who's going to put his name first, and we will go. He will start after Dr. Charles, and then we will complete. Okay. So, Dr. Charles, dear, what is your station, Dr. Charles?
LD sterilization.
Yeah. Okay. Okay, so this is the station. Okay. There are a lot of communication in this station. Please pay attention to the feelings of the mother. Let her speak when she is trying to explain what is the problem which she is trying to avoid and their past experience with her son and so on. Okay? Don't rush by asking questions and explanation. Just try to understand the perspective of your patient if there are a lot of emotions in everything. Okay? 1, 2, 3, 4. Just you have 2 minutes, just arrange your thoughts and write down your notes. Okay?
No, this hurts.
Okay? Ready?
Yeah, the patient name is Robin or John Smith. Which one?
Let's say that his name is Robin. No problem.
Okay. Yeah, I'm ready.
Okay. We'll start now. One, two, three, go. You can start.
Hello.
Hello there.
Hello. My name is Dr. Stanley. I'm one of the doctors from the mental health department. I believe you're Dorothy, the mother of Robin, right?
Yes, yes.
Okay. Welcome to this discussion today. I'm meant to understand that you booked this appointment because you've got some concerns about your son, Robin.
Yes, doctor. He has a mental retardation. He's been diagnosed with this since birth, and he cannot take care of family. And his girlfriend is now pregnant, and I don't want to be the caregiver of another baby who has mental retardation. I suffered a lot with him, and I really, really beg you to sterilize him if you don't mind, please. He cannot have children.
Hmm. Dorothy, I can see from your face that you seems quite distressed with this situation. But let me just ask you some questions and we'll see how best we can support you, okay?
Okay.
Yeah. You said if I heard it clearly, you said John Robin is currently having an affair with some other person and the girl is pregnant. Is that correct?
Yes, yes, doctor. And you know, his girlfriend is also mentally retarded. and definitely they will not have a baby who is going to be healthy, and both they cannot be a good mother and father. I'm not going to face the same ordeal with a new baby. I'm too old to take care of his children.
Okay. Okay, Dorothy, let me reassure you again that we're going to do whatever that is in the best interest of Robin, okay?
Okay.
Yeah. Where is Robin currently?
He decided to live alone. He is taking some sort of governmental support, and he's living with his girlfriend in a studio.
Okay. And that's where the girlfriend is also staying currently. Am I correct?
Yes, yes, yes.
Okay. Okay. So you talked about difficulty in raising him up. Can you share more light on that?
Well, doctor, I was a single mother. His father left me alone with him, and since the very first years of his life, he was different from other children, and he was totally dependent on me. He couldn't join a school, and he needed a school for those kids with special conditions. And
Okay.
and all of my life, he was dependent on me, and I was taking care of him, and he was putting himself in a lot of problems. And whenever he is stressed, what does he do? He exposes himself, and I and I was put in a lot of problems because of his behaviors. And now he is going to have a baby, and I cannot face this again.
Dorothy, I clearly understand what you're trying to say.
Please,
We'll see
please,
how to.
can't you please? I will sign all the papers. Just sterilize him. I cannot face this, doctor. Please.
Dorothy, let me just clarify with you. Currently, how is John's mental health?
What?
John, how is Robin's mental health now?
Well, he's following up with the psychiatric services, and he is taking his
Checkups.
medications, and everything is
Okay.
okay as far as they say. But he cannot be a father.
Okay. Does he have any issues with his physical health also?
No, no.
Okay. Okay. I appreciate the fact that you're afraid that they may come up with another child with learning disability, but um, let me also reassure you that learning disability doesn't just transfer from parents to children like that, without any obvious thing. So let me ask you again. When John was growing up, what was the exact difficulty he had?
As I said, he was totally dependent on me, and he couldn't join a normal school. And whenever he was stressed, he just exposed himself.
Okay. Okay. Learning disability doesn't automatically transfer like that. When the child is born, there will be thorough genetical assessment of the child, and there's tendency that the child will likely not be having learning disability also. Okay.
Okay, doctor. So what would be the
Yeah.
possible solution for this problem, doctor? You know,
Yeah.
the social services said to him that they are going to take his child, and he exposed himself again. And when I was informed this, I immediately came to you to sort this out.
Okay. Dorothy. To the best of my knowledge, social services are actually there to help, not to cause more harm. So they're going to support Robin, to see how best they can cope with the new baby when the baby comes. Okay. Then you asked about another solution to that, to the sterilization you asked for, right?
Yes.
Yeah. There are other modalities of controlling birth that could be explored, like family planning. Is this something that you think that would be
Well,
possible?
1 minute remaining. I don't know, doctor.
Yeah, with the help of our speech and language therapists, the best family planning method could be communicated to John and the girlfriend, and they will be able to cope with that. Okay.
Well, I'm the one who's going to take care of the child, doctor.
No, the child will be given birth in the hospital, and the social services will help in upbringing and also teach John and the girlfriend how to bond with the new child. Is
Okay,
that all
doctor.
right?
So how can you help him then?
Huh? How can? Sorry, I didn't get that.
How can you help him?
Okay. Well, I'll link the couples up to with the child and the perinatal services, and the management of the pregnancy will start with the collaboration of the mental health units. Okay, and the child will be delivered in the hospital mother and baby units where appropriate care will be taken care of for the mother and the new baby. Okay, you won't
Yeah.
have any issues stressing to take care of the new baby. Okay.
Time. How do you feel about what you did?
All right. Thank you very much for speaking with me.
Time, dear, time. How do you feel about what you did?
Um,
Give me feedback about what you did. This
I,
is a
I felt good.
difficult station.
It's about it's about communication, as you said. And I
Yeah,
wasn't hearing you
exactly.
properly initially.
Lot of communication,
But
please. And whenever she raises an important point, pay attention to it. He raised the point of exposing himself, which is very serious, and you don't pay attention to it except maybe in the third time. I said to you what all the history, and then you asked me again, what are the problems which I faced with him during his upbringing, as if you did not pay attention to what I'm saying. Um, I said the question of the social services could be answered in a better way. So let's see how can you deal with the station. As I said, pay attention. The magnitude of the communication skills and the social information in this station is considerable. You are going to talk to a mother who is stressed because of the difficulties she had in upbringing her son, and she is worried that she's going to take care again of this. So, and show empathy and don't let her talk about her difficulties. Okay. So the first thing you do here is, as I said, you introduce yourself. Don't forget how to introduce yourself, please. Sometimes because do not. I'm stressing on this again and again because many candidates do not know how to introduce themselves. If you want to go there and say, I will be a member of the Royal College, at least you must be able to initiate a setting, a clinical setting in the right way. Identify yourself, greet the patient by her name, and explain the cause of the talk with her. Very important to start by showing empathy. I can see how much you are stressed. Yes, rest assured that I will do my best to help you. As we said, there are some particular points which you should go through to make sure that we are going to score as much as we can. As long as we are going through the dialogue, we are going to score points in the mark sheet. So after uh, showing empathy, you want to know some social information about this patient. Okay, so she's talking about having difficulties in raising Robin. Can you tell me more about that? This is how you start. This is what is worrying her. So let her speak about the problems she had in upbringing her child and his life circumstances now. And you want to know exactly what is the condition of this boy or man. Does he have a job? Can he depend on himself? Since when is he living with his girlfriend? Uh, since uh, since living with him, they faced any problems? Okay. How did you know that her girlfriend is pregnant? His girlfriend is pregnant. Why do you feel that he will not be able to take care of his child? And why do you feel that he will be in charge of the child? As you can see, the approach is a bit different, not regarding the plan. The plan is the same, but as you can see, we are focusing on the social part of the biopsychosocial information because it's all about the social issue. of this young man who is not able to be a father and is going to have a baby and so on. Okay? So this is how you start. After showing empathy, you want to know the difficulties which this mother had in the upbringing of her child. Let her ventilate, and you want to know exactly what are the circumstances of this young man. If he is having a job, is he dependent or independent, living with his girlfriend since when, and if they have ever faced any problems, and how did she know that she is pregnant? Maybe this lady is not accurate. And why does he feel that he's not able to take care of his child? And why do you feel that he is not that you will be in charge of the child? I have this station twice, and I passed them, and this is the approach which helped me to pass. You want to know some physical information about this patient, and finally psychological, whether his mental state is stable, just routine questions if he is taking any medications, any hallucinations or delusions, okay, any drug misuse, okay, and you must know what could be the reason for this learning difficulty. This is part of a psychological assessment. And I think in this station, according to the feedback of the mother, that this type of mental, the retardation or learning difficulty is latent to some birth problems. Okay, so basically he doesn't have a genetics background which could be the cause of this mental health problem. Okay, and you want to know some information about the learning difficulty in his girlfriend. Very important to ask about the risk because there is considerable risk in this station. So as you can see, social and risk are very important in this station. This is how you start. This man is exposing himself. Pay attention to this. Can you tell me more about that? When did this happen? Where? Does he have any sexual pleasure when he does this? What happened after that? Since when does he have this behavior? Very important to ask these questions because this must be included in your management plan. Okay, there must be some sort of behavioral therapy for this boy so that whenever he is facing any stress, does not expose himself. So this is how you start your station. Show empathy, gather some information about the past history of this child with his mother and his current circumstances, some psychological information, particularly the cause of this learning difficulty, and the if she knows any sort of information about the learning difficulty in his girlfriend, and very important to ask questions about this. And then you explain the queries or the questions which is the mother is raising, and pay attention that there is no particular diagnosis here to be explained. You are going to explain her questions. She is asking questions and raising some assumptions, and you must explain what she is raising. So about the sterilization, this is the best answer. I understand your concerns. However, this procedure cannot be done except after his consent. Okay, and it will add to the stress. Very important to mention this. Say something different from the other candidates. If this boy is sterilized, he will be more stressed, and this will make his life unhappy. Okay, and will negatively be reflected on his mental condition. So if she sterilizes him, he will not have baby, but his mental condition will deteriorate. Moreover, there are other better alternatives for family planning, which we can discuss later. So this is the best answer regarding sterilization. Okay, it cannot be done except after his consent, and she must pay attention that sterilization will not make his life happy and will be negatively affecting his mental condition. And on the other hand, there are a lot of effective ways of family planning. They will have children with learning difficulties. Okay, this is also an important question which should be raised in this station. You must have in your mind this simple figure: 2.5% of born children have learning difficulties. Okay, and there are many reasons behind the learning difficulty. And having a learning difficulty does not mean that the child will have a learning difficulty. Are you following me, Dr. Charles? Okay.
Yes.
Okay. Moreover, the possibility of having a child with learning difficulty does not justify the process of sterilization. Suppose that there is yes, he is going to have a learning difficulty, a child with a learning difficulty. It does not justify the sterilization. So her assumption that having a learning difficulty is equal or to sterilization is not accepted. Okay, but we don't say it in a blunt way. We say it in a very diplomatic way. Okay, the possibility of having the child with learning difficulty does not justify the sterilization. Number 3, she will stress that he will not be able to take care of the child. Okay, so how can you answer this question? Unfortunately, this you'll never see this in a textbook. I gathered all these answers from my experience and from the experience of the candidates, and I passed the stations twice. I understand your concerns, but having a learning difficulty does not mean that he'll not be able to have a family or be a non-functional as parents, okay? Okay, are you with me? However, the parental ability will be addressed in the management plan. Okay, so you must argue with if she says that he's not going to be able to have a family, to be take care of a child, you just justify that. Not you must ask. This is not also she's imposing these things. No, it is not accepted. Having a learning difficulty does not mean that he will not be able to have a family or be a functional as parents. And after all, you are going to assess his parental ability in the management plan. Now, she will also ask question that saying that the social services told him that they will take his child. Now, pay attention to the following: that the source of information to her is not the social services. Her son told her so. There is a good chance that he misunderstood what he has been told. Okay, simple as this. So you must put this in your discussion, and I want you to say something other from the other candidates. I know what is written in the other notes. So the role of the social services is to protect the child if there are concerns about the safety. There is a big chance that Robin misunderstood the conversation with the social services, and we can manage this in the management plan. Later on, you are going to book another appointment with the social services to see what could be the opinion of the social services regarding his condition. I am the one who is going to take care of the child. Okay, again, she is going to stress on this. Now, how to answer this? Understand that she had a hard time raising her child. However, there are a lot of improvement in the social services, okay, and they can help Robin to have a family, and rest assured that he will not bear the responsibility of the child. And on the contrary, pay attention to this sentence, and because the role player, when I said to her, she was very happy. On the contrary, most probably you will enjoy the experience of being a grandmother. As I said, the magnitude of communication, this station is very good, is big. It's all about your communication, okay? So when you say something like this, definitely will add to your chances to pass. How can you help him? Do your formulation, okay? What is the diagnosis? Learning difficulties, mental state is stable. However, there is risk because of the maladaptive way of coping with stress, because he exposes himself. All this in background that he is independent, he is about to have a baby, and we need to know information about the couple's parenting ability. So this is how you formulate. The first line is the main psychological problem and the level of risk. The second line is the biopsychosocial information, which you know or you need to know. Here we need to know some information about the couple's parenting ability. So the management. As we said, when we start talking about management, the first thing is to start by saying, what are you Dr. Charles going to do, and where the patient is going to be treated. So What are you going to do? You want to see Robin yourself. You must say this so that you are a certain doctor. It's not about sending the patient here and there as if you are in an oral exam. I'm asking you about the knowledge of how to manage this patient. This is a true clinical situation. So you want to see your patient, to assess him yourself, okay? You must do thorough risk assessment and address his concerns. And I will need to talk with the social services to understand more about what has happened with him. So this is how you start. What are you going to do? You want to talk with your patient and you want to talk with the social services to know what happened. Number two, there will be a need which will cover all his needs physically, psychologically, and socially. Psychologically, the main problem here is exposing himself. He is already been diagnosed with mental retardation. He doesn't need any medication. So what is the problem psychologically is the habit of exposing himself. And there can be fair management to this by the CBT, okay? And also there can be programs for your son and girlfriend during the pregnancy to help them prepare taking care of the child. Numbers, the social services. Regarding the social circumstances, we can book an appointment with the social services to discuss the parenting ability, and the social services will do a parental assessment to determine the ability of the couples to take care of the baby, okay? It will also be a chance to discuss the support which they can get. So some social information, okay? As I said, the approach is different, but the general outline is the same. Some information regarding the social services. It's all about the social services and how to address the concerns of this lady. Physically, very important to arrange with the obstetrician to follow up the pregnancy, etc., and do it an ultrasound. Is a challenging station, as you can see. The answers are not a textbook answers. It depends upon your knowledge about the social services in the UK and your communication skills. I hope that if you don't have the notes, you could see the this Zoom session when I download it in my YouTube, and you can take screenshots.
All right, thank you.
Okay. I want to go through the mark sheet because I lost a long time in this stage. So I hope that you found that helpful. Thank you so much, Dr. Chops.
Thank you so much. Thank you.
Okay, so who would like to go next?
Can I go next?
Dr. Amal?
Noor.
Yeah,
No,
I would love to go next.
No, Dr. Amal wrote her name before you, Doctor. We can go,
No,
Dr. Noor.
I wrote my name first.
No,
I think it's different. I wrote my name first here in the chat, but you wrote your name first in the group, so I'm
Yes,
not sure how to
I wrote in
wrote.
the group. Yes.
no,
Okay.
not in the
No.
group. It's here.
Okay.
So if we can just give the chance to Dr. Amal, if you don't mind. So what is your station, Dr. Amal?
It's dementia and driving.
This is also in severe dementia and DVLA.
Read. So what's the patient name? Shall I ask the...
Let's say that her name is Mrs. Green.
Okay.
Okay, can I just roll up?
Okay, I'm sorry, shall I start now?
No, if you want to read the role player's note, or they can just need to read the role player's notes.
Oh, no, I don't want to read the role player notes.
Okay, I'm ready whenever you're ready.
Okay, I can start.
Okay. Give me just 1 minute.
So I'm speaking to the son, right?
Yes,
Okay.
yes. Let's say the name is Michael
Okay.
and his mother is Mrs. Green. 1, 2, 3, go.
Hi, I'm Dr. Mahmoud. I'm one of the doctors with the mental health team. Am I
Oh.
speaking to Michael, Mrs. Green's son?
Yes, yes.
Nice to meet you, Michael. My understanding that you're here to speak to me about the condition of your mom sounds that your mom is not happy with the outcome of the meeting she had with us recently.
Yes,
And
yes.
I understand that you want to ask me a few questions. Hopefully, I can
Y- y-
answer all your questions today.
Yes, what was the outcome of her visit to the clinic?
Okay, so of course I'll go with you through all the results we have here. But before that, can I just check with you what's your understanding of what has been happening recently?
Well, I know that her memory is not good, and she's a very stubborn lady. She has been a very, very independent in all her
Mm.
life, and she's not happy that anyone takes a decision for her. And she's driving now, and
Mm.
a lot of problems because of this.
Okay. Right. So a lot of problems because of this. Could you please share with me these problems?
Well, every now and then she did some sort of accident. All of them are minor accidents, and
Mm.
definitely
Right.
this is not something which I could say for.
Mm. Thank you for sharing with me all this information. But as you mentioned, sounds that Mrs. Green has been struggling with with her memory recently, and we received a referral from the GP about that.
Yes.
She met our specialist nurse, and she had some memory testing. So the memory testing, she had something called Addenbrooke cognitive examination, and she scored 50 out of 100, which means that she has significant memory impairment. Is that clear?
Well, I just want to, yes, it's clear, but I would like to know what does the score of the test is?
Of course, yeah, that's what I'm here for. So the thing is, this test, it doesn't only assess the memory, it assesses different domains of how the brain works. And she scored low in two main domains. One of them is memory, and the other one is what we call visual spatial function. And I
Yes.
mean by that, her ability to relate, to physically relate things to each other.
Yes.
Like, for example, maybe when she's driving, she might struggle to estimate the right estimations of the roads or of the cars, the other cars in relation to her car, which might explain the minor accidents and the things that you have shared with me at the moment.
I see, I see. Well, she did also some blood tests. If there is anything significant, I will be happy to know.
All right. So the other thing that my colleague, the specialist nurse, have noticed that Mrs. Green didn't look that she was taking care of herself, and she smelled of alcohol. And to be honest, my colleague was quite concerned about her and asked her to stop driving. And we got in touch with the GP in terms of these concerns as well.
I see.
We heard back from the GP, and we found out that Mrs. Green is drinking on daily basis around half a bottle of whiskey. And I'm not sure for how long this has been going on. Is there any new stressor at all?
Well, she has been drinking for a lot of time. To be honest
Okay.
with you, it has been going on for, but not more than half a bottle every day. She's very keen not to drink more than this.
Not more than half a bottle of whiskey every day. So she doesn't drink anything else.
Yes,
right?
yes.
Okay. The GP also did some bloods, and the bloods showed some abnormalities with her liver function. this would reflect or can be related to the chronic alcohol intake.
I see. So do you feel that she's able to drive then?
Actually, the GP also was concerned about driving and advised her not to drive. So my colleague advised her not to drive, and the GP advised her not to drive. But sounds that she's not happy with this outcome. And I wonder how to support her as like our team and yourself and as her family to stop driving.
Well, how can I do this? She is very, very stubborn.
Okay. I just wonder, does she have any daily commitments that she needs driving for at all?
Well, actually, no. As I said, she doesn't want anyone to take any decision for her.
Right, because when it comes to like if she has two main problems here, the memory impairment and the alcohol, and
Yeah,
of course the alcohol use.
How can I persuade her to stop driving?
Actually, she has to inform the DVLA herself that
She doesn't want to do
about the
this.
results.
She doesn't want to do this.
Okay, so the thing is, because it's a quite tricky situation, but as you mentioned yourself, we are really worried about her. There is significant risk on herself and on other people if she drives. That's
Yes,
why
I see.
if she's not willing to stop driving, probably we have to, as professionals, to inform the DVLA ourselves.
Okay, okay. So
We don't prefer that. I'm
how
sorry.
can you do? So how can you help her then?
I'm sorry, I didn't hear you.
What? How can you help her? 1 minute remaining.
So who is she living with?
She's living alone.
She's living alone.
Yeah.
I just wonder, probably she needs support from the family or from our team to make sure that she has the daily needed things that she needs. And I wonder if someone can, I don't really know, because I think this has to be a collaborative decision. Is there any chance to speak to her, to convince her again, to ask her to hand the key to yourself?
I don't know though.
I don't know. Actually, we need to try, because it's always good to involve her in the plan. But if she's too stubborn, we need to inform the DVLA ourselves, who will write to her and ask her to stop driving. If she doesn't follow the DVLA rules, probably we might involve the police. I don't prefer to go down this route, so it's better to meet her again, maybe ourselves and yourself, and try to convince her.
Okay.
How does it sound?
Time. How do you feel about what you did?
I don't know. I think I spoke a lot.
It is not an easy station to understand, and unfortunately.
Yeah, I struggled with describing the visual spatial as usual. I always struggle to describe the visual spatial
okay
thing.
So basically this station is a difficult station. It can go anyway according to the dialogue with your role player, but basically it will not go out of the content of these notes according to my experience with all the candidates who have passed this stage. So as I said, you introduce yourself, and the first thing is to explain he will raise the question about the problem which his mother has faced regarding the memory and what are the memory tests and so on. So just explain the results of the memory test, that her memory is weak, and just ask her some questions and start to gather the biopsychosocial information. Okay, she's more forgetful. Okay, what about her language? You want to establish that she has.
Why to do this? I mean, she's already diagnosed. If I go down this route, I won't finish.
Where exactly is it written here then?
I mean, it's mentioned here that she scored low in two main domains, the memory and the visual spatial. So why do I need to ask him about the other domain?
Still, you cannot just diagnose with a memory with a psychological test. It is a clinical
assessment. I
assessment.
Understand, but I think I will run out of time if I do this. I just thinking with you
okay,
out loud.
If you do whatever you want, I'm just telling you how to pass this station. If you're not happy, okay, you want to eventually, you needed to ask these questions. By the way, you asked me the questions, okay? You wanted to know if her memory is forgetful. Okay, what about her language? What about her mood and so on? Biologically, very important to ask some physical questions because her medical condition is she is vulnerable, and you already asked some social. All the questions you have asked, by the way, I'm just telling you to ask these questions in an organized way. You ask these questions. So socially, you wanted to know more about herself, which you have asked if she is living with anyone and so on. And then risks, you asked about the risk, as I said, you asked. So all these questions you have asked, you are arguing me about 2 or 3 questions which you want to know about her memory to establish the diagnosis of the diagnosis of the dementia. But all these questions you ask, I'm just helping you to organize your approach. So you start by asking these questions which you have asked, psychological, biopsychosocial, and level of risk. It's very important. And you ask about this. Risk, all you have, you ask about the question regarding her alcohol and the car driving and so on, whether she is able to take care of himself and so on. So this is the first thing you want to know. Then you explain what has been going on. This is your formulation. Pay attention that your task is to formulate. You will never be able to give a right formulation except asking these questions. Let's see the tasks here. Formulate her condition, formulate. As you can see, the Royal College is very keen to see who are the candidates who are able to formulate, who understand how to approach their patients and to know what are the points which they should focus on in their management. So you'll not be able to formulate except after gathering enough information of her biopsychosocial information and risk in order to make a sound formulation.
Makes sense. Thank you.
Okay, so this is how you start. And then you start to do your tasks in formulation. The first line is the main psychological main psychological diagnosis and the level of risk. Okay. Yeah. You start to formulate, okay, and when he's going to ask you questions, immediately answer these questions. So he's going to ask you, is she able to drive? From our discussion, the driving is associated with high risk. It is recommended to inform the DVLA, which will suspend her license because of the high risk. I'll give you leaflets about the DVLA and the dementia. How can I persuade? And this is the question which is tricky, which you found it difficult. And this is the answer which helped the candidates to pass. It will be helpful if a meeting with her is planned, which will include her relatives and a psychiatrist and the social services. We can discuss with her the possible safe alternatives, okay? And at the same time, address all her concerns and the need to drive. Also, it will be explained to her the possibility of legal action taken for her safety if she insists on driving, like custodial removal of the car. Okay, so this is the best answer, okay? Please avoid labeling your patient. You said that too stubborn. You said that if she is too stubborn, don't say this. Don't label your patient by any means, okay? As I said, you must explain the diagnosis, that the dementia, if he asks about the dementia. And then start management. So what are you going to do? And where the patient is going to be treated? What are you going to do, Dr. Amal? This is what you are going to do. Dr. Amal, you must see your patient. This is the first thing you should do. You must see this lady and assess her mental and physical condition, address her concerns, and explain the diagnosis to her. This is what you should do. This is the first point in your management. Okay? And according to the assessment, she can be managed either at home with a care package, or she can be placed in a nursing home if the risk is high. So the first point when you start talking about the management is to talk with your patient, do a thorough risk and physical assessment and mental state assessment, talk with your patient, address her concerns, and explain the management plan. And according to your assessment, the best place for her, either at home with a care package, or if the risk is high, she can a nursing home might be considered. Okay, Dr. Ahmed, any question? Okay.
To be honest, it wasn't clear for me if this is dementia station or if she has these problems because of the alcohol. So I didn't know how far do I need to go in terms of the management plan.
Okay, really, I really appreciate this query. That's why we start by gathering this information to make the patient the picture clear for you. If you don't know whether it is a dementia, why don't you ask about the memory? Okay.
Makes sense.
Why don't you ask him some question about the mood? Maybe she is depressed, and if she is having any hallucinations, unusual experiences. So this is how you start. You are just you are answering your question. Why should I start this gathering this information? It will be a waste of time. But at the same time, you don't understand you will not be able to understand the problem if you don't ask these questions. Okay. If you are organized, you will cover everything. If you are organized, you will cover everything.
Thank you.
Okay, let's see. After your formulation, the management, as we said, first thing, you must talk with your patient, Dr. Emel, and you must mention according to your assessment whether this patient is going to stay at home or she might need to be in a nursing home according to the level of risk. So this is how you start. Now, regarding the alcohol detoxification, bearing in mind that she is old and the possible physical complications from alcohol withdrawal, it is better for her to do the alcohol detoxification in a medical setting. Okay, so this is where she's going to be treated. If she's going to do a detoxification of alcohol, she's going to do this detoxification in the hospital, not at home. Very common for the elderly to enter in a confusion if they are in the alcohol withdrawal condition. Okay.
Can I say something? I know that maybe you won't like this question, but I think if I would say all this management plan, I won't have time to address his concerns.
Well, his concerns are basically these questions, doctor, which is mentioned here. As I said, I asked you to read the role player's notes. Okay, it is written here. These are his questions.
Okay.
All these questions will be raised in the dialogue with the role player, and the notes are tailored to answer these questions. Okay? I asked you to read the role player's notes, but you did not.
Oh yeah, I'm sorry. I just thought that would be better not to read it.
Okay, so let's continue. Regarding the investigations, very important to know the liver functions, kidney function, blood chemistry, the heart racing, and this will give us an idea about her physical condition and fitness to take the medications. Okay?
Oh, thank you.
Very important.
Thanks a lot.
Okay, so there will be a team which will cover all her needs, physically, psychologically, and socially. Physically, you will liaise with the GP, discuss her physical condition in light of her post-medical history investigations. Very important to mention this. Your management must include all the facets of her needs, so the psychological, social, and the physical. There is a lot of physical issues here. She is elderly, she has liver functions problems, and she's taking alcohol, so you must liaise with her GP. The psychological condition, she might need an anti-dementia medication, which will decrease the rate of decline in her memory. Because the memory problems, she will find a dosage box or drug patches helpful. In addition, and this will further. Well, very important, when you talk about the medication for a patient who is having a memory problem, you must immediately mention that you either going to give a dosage box to help him to remember the medications, or patches, or the nurse which will follow him at home. Don't say that and you'll give him an anti-dementia medication. So who's going to give him this medication? Okay, are you with me, Dr. Emma? Say something different. Say
I'm with you. I'm
something
just
different from
trying
the other
to.
candidates. Otherwise, you will be in the same category of the other candidates. We want you to pass. Say something different. When you say this, you understand, you will give an impression that you know the clinical situation and the needs of your patient. Giving an anti-dementia medication is not enough. You must make sure that he's going to take your medications. Okay, regarding social services, they will do a carer assessment and will formulate a carer package. Okay, we carer assessment and formulate a carer package. And because of the high risk, it is important that she or the nearest kin, okay, pay attention to this, doctor. Because of the high risk, it is important that she or the nearest kin informs the DVLA. If this is not possible, the social services can help in this issue. Okay, doctor? So this is the management about informing the DVLA. Because of the high risk, it is important that she or the nearest kin informs the DVLA. If this is not possible, the social services can help in this regard. And then terminate by saying, I will give you leaflets, etc. Fortunately, the pass rate in this station is not high or is not good at all. So please, it needs a lot of practice, I will not go through the mark sheet. Sorry, doctors. I explained how to use the mark sheet. So we can shift to another station. I hope that you found it helpful. Thank you so much.
Thanks. Thank you.
Thank you. Who would like to go? I think, doctor, this is the turn of Dr. Nora. What is your station, doctor?
Serotonin syndrome.
Okay.
You can start.
We can start very clearly.
The name of the mother?
Let's say that the name is the patient's name is what? Michael, and his father is Mr. White. Okay, patient's name.
Mother?
Mother name. The patient's name is Mike Robin, and his mother is Mrs. White. Yeah, 1, 2, 3, go. 1, 2, 3, go.
Hello, this is
Hello.
Michael. I am Dr. Hassan, I'm a psychiatrist working here. I
Hello.
understand that you have some concern regarding your son, Robin, and I'm here to help you.
Well, I don't know what's going on. Why is he admitted in intensive?
The voice.
I don't know what's going on. Why is he admitted to the intensive care unit? What's wrong with him?
Yes, I can understand it's a difficult time for you and for Robin also. And I wanted to reassure you that everything will be okay with him. But I wanted to understand the situation more. Can you tell me what you know about Robin? Why he came to the hospital?
Well, he was not feeling well, and his physical condition was good, but when he came to the intensive care unit, they said that he wasn't. To the emergency unit, they said that he must be admitted to the intensive care unit.
Yes. From my understanding, he diagnosed with depression, and he was on a medication called fluoxetine. And few days ago, he shifted to another medication. And he came in a presentation of some symptoms like being hot and high blood pressure and stiffness. Are you following me so far?
Yes. So
Yes,
what is wrong with him, doctor?
Yes, our best guess that he passing through something called serotonin syndrome. Have you heard about this before?
No, what is this serotonin syndrome?
Serotonin syndrome, as I mentioned, is a combination of different symptoms. And from the name hence, it is due to increase a chemical in the brain called serotonin. This serotonin is very important for mood and motivation and sleep and appetite. But at the same time, if it increased in excess amount in the body, it will affect him in a bad way, like affecting regulation of blood pressure and temperature, and they make his muscle stiff and may become confusing, as you mentioned.
What could be the reason for this serotonin syndrome?
Yes, I wanted to understand the situation more, so I can ask you a couple of questions about
Okay.
Robin, please. Yes. Are you aware that he followed the instruction of his psychiatrist about taking medication in
Yeah,
a
he's
right
taking his
dose?
medications regularly. Yeah.
Yes, at the same dose was prescribed.
Yes,
There is any
yes.
chance that he may mistaken increasing the dose by any way?
No, as far as I know, he didn't take except maybe the dose of 3 days. He has been following up with him for 3 days. Yes.
Yes. There is any history for Robbins of taking overdose before?
No.
Okay. Sorry for asking this question. There is any possibility of taking any street drugs?
No.
Okay. Thank you for this important information. From our discussion, it seems that serotonin syndrome is the best guess because he shifted from one medication, antidepressant called fluoxetine, to another one called venlafaxine in a very rapid and short period. And this led to increase more and excess serotonin in his body.
So is it a serious condition?
Unfortunately, it's a serious condition if not treated properly. But the good thing here is that he is in the best place. He is in the right place right now, and we are keeping our eyes on him.
Okay, doctor. So could it be something else?
As we discussed, it could be, in the case of Robin, it's our best guess that it's serotonin syndrome. But in general, it could be increasing the doses of antidepressant or taking more than one antidepressant. And some street drugs also affect serotonin, level of serotonin, and decrease it in the blood.
Well, how is he doing now, doctor?
Yes, we are working now as a team with Robin. The physician is keeping him safe and observing him very closely. The first thing we did, stopping the antidepressant, and it is the most important action must be taken. And it is will be improved most probably in about 24 hours.
I see. So how long does the serotonin syndrome last?
As I mentioned, it is most probably to take about 24 hours. Sometimes it may last for a little bit longer period when sometimes complaining the patient from muscle aches. But
Well,
the most common, it will be improved completely and quickly.
is he in pain?
Sometimes muscle stiffness may cause pain. And be sure that we are around him. If he has any pain, we will deal with it by giving him medication and the muscle relaxant.
Well, could be any damage to his health.
As I mentioned, will be resolved completely and quickly because we picked it up early and we stopped the medication which causes increased serotonin in his blood.
Okay, so how are you going to help him?
First of all, we just wanted to explore the situation more. When he become better, when he improve, we will discuss with him what led to this situation and discuss what does he follow the instruction of stopping the medication and taking the other and the dose he take it and any other physical or any other medication. when we understand the situation well, we can deal with it in the best way to avoid repeated the situation again.
Okay.
Do you have any other question?
No, thank you. Finished?
Your voice is very, very weak. I don't hear most of the
Yes,
speech.
sorry. So you have finished? You have finished?
Yes, yes.
Okay, so okay, doctor. Sorry, you just inform me if my voice is weak. I was putting the slides in front of you so that you can do better. So let's see how we can do this station in a better way. Any other medication, you forget to ask him if he's taking any other medication. It's not only the street drugs which can cause or add to the possibility of the mood of the serotonin syndrome. In this scenario, the patient has suffered some sort of pain in his knee while playing football, and he was on tramadol. And tramadol also adds to the possibility of having serotonin syndrome. Okay, so tramadol was not given as a street drug. Tramadol was given as a medication. So you ask about everything, but you forget to ask if there is any other medication given other than the psychiatric medications. When I ask you the other possible differential diagnoses, you said a sentence, please don't say it. You said the serotonin is the best. I don't know why did you say this.
Best guess.
The
Yes.
best guess. You just say that the most probably the serotonin syndrome is the diagnosis.
Okay.
When I ask you the serious condition, it is serious. Don't avoid saying that the possibility of having a fatality can be up to 1%. Differential diagnosis asks if could be there any other possible diagnoses? Yes, it could be the neuroleptic malignant syndrome can be included as a differential diagnosis. However, because of the course of the action and the temporal relation with the medications and the nature of the medications, most probably it is the serotonin syndrome. Okay, so when you start the station, please start by asking some questions which will help you later on to do your formulation, and eventually you needed to ask these questions. So I'll start by asking him to understand more about your patient, and then explain and avoid explaining then asking these questions. Start by just gathering the information which will help you to give the right explanation later. Okay, so I started by asking him about his physical or medical problems, if he has taken any medication other than the antidepressants. And here this patient has been taking tramadol according to the scenario. And if you just check, the tramadol also works on the serotonin receptors, and it can add to the possibility of having serotonin syndrome. Psychologically, you asked about the information related to the medications, whether he's taking his medication regularly and so on. Everything you have asked about it, but I hope that you would have asked it early. Very important also to ask about the social circumstances and risk. Very important. Even in this station, show that you are safe practitioner. Always ask about the risks and social information to show that you are comprehensive in your assessment of your patient, and the risk is always in your mind. Your explanation was nice. Serotonin syndrome is the level increased in the level is increase in the level of serotonin. Okay, because of the medication which he has taken and so on. Pay attention to this, please. In this particular station, you will find a paper attached to the chair. Okay, a paper attached to this chair, and this paper is exactly like the paper you will find in your patient's file in the nursing section, which include the charts of the physical data, the temperature, the pulse, and the blood pressure. Okay? And with me, Dr. Noura?
Yes.
So this is the vital data of the patient, because later on he is going to ask you how the patient is doing. So when he asks you this question, okay, how is he doing? This question, simply you should pick up this paper in which the vital data of the patient is in, and answer him in view of the data in this paper. Are you with me, following the doctor? So if you are not acquainted about the charts of the blood pressure and the temperature and the pulse, you can have a look. Very simple to add to, just to read them. Very simple. Just go to the file section of any of your patients and you'll find them there. Is it a serious? We said serious up to 1%. Why did he get the serotonin syndrome? Yes, antidepressants, very quite good. How long you answered this question? How is he doing now? As I said, answer this question in the view of the paper attached to the chair. Pay attention to this. Don't do the mistake which all the candidates do. You just give a false reassurance. They expect from you to answer the question according to the vital data written in this paper. Is he in pain? As you said, there could be a possibility of musculoskeletal pain. Permanent damage, most probably, if the certain syndrome does not cause a permanent damage, except if the patient is recovered. How are you going to help him? Do your formulation. I'm not going to go through the formulation. You can just, let's say, okay. So he has depression, suffering from serotonin syndrome, which is a medical emergency. Your first line is your main psychological diagnosis and the level of risk. And the background is the biopsychosocial information, which here he doesn't have anything, whether biological, psychological, so just everything is good in this patient except for the serotonin syndrome. So the management, I hope that you would have elaborated more about the management. You didn't mention anything regarding the management. So he would be in the intensive care unit. You liaise with the physician and update the father with his condition. Okay, you must, Dr. Noura, you must see your patient. Okay,
Yes,
and
but
discuss
he
this.
is already admitted in ICU and everything of this investigation, and I
Not
see
because
him.
he is in the ICU, he is not your patient. You must follow your patient, even in the ICU. Okay, must say, I will follow up, liaise with the physician, and update you with the condition. Okay. The investigations, you need to do some blood tests, as we said, the blood, liver function, kidney function, blood chemistry. You must mention these. And then regarding the management, there will be a team which will cover all his needs, physically, psychologically, and so on. Very important to mention what is the management in the intensive care unit. So basically, the medication should be stopped, which has offended him, the tramadol and the fluoxetine or the sertraline. Okay? And you are going to stabilize his vital functions and follow up the temperature, which will be controlled by cooling blankets. Blood pressure would be normalized by medications. There is a place for a medication called cyproheptadine, which antagonizes the serotonin level. Please say something different from the other candidates. You will not find this information in the other notes, but cyproheptadine is a documented medication for the serotonin syndrome. Psychologically, if there is agitation, if the patient is agitated, serotonin syndrome can cause agitation. This can be best managed by benzodiazepines. Okay, are you with me, doctor?
Yes.
Okay, he will be transferred to the psychological side once his physical condition is stable. Very important to mention that this patient has serotonin syndrome, and he was going to start on another medication which is less liable to cause this problem, like mirtazapine and bupropion, and you'll follow him up closely. Okay, doctor? You have any questions regarding the management?
Thank you.
Okay, so this is the management, and finally terminate by saying, I'll give you leaflets, etc. So this is how you manage the medications. Don't forget the cyproheptadine. It is psychologically, there is a role for benzodiazepine, okay, and document the serotonin syndrome, and don't forget to use a medication which does not cause this problem or has less possibility to cause this problem, like mirtazapine and bupropion. Okay. Let's see according to the mark sheet. So don't be frustrated. You did not formulate, unfortunately, this point might not be scored for you. You recognize the finding, the result, your plan. I did not hear anything regarding the management plan. You didn't say that you are going to follow up the patient and so on. So this point also not going to be scored for you. Risk management, yes, is going to be admitted to the ICU. Psychological or social interventions, I didn't hear anything. So pay attention to what I've said in order to make sure that you're going to score these points. Okay, thank you so much. Don't be frustrated. You are very clever, but I'm just telling you what.
I promise it will be better next week, inshallah.
Yeah, okay. So who would like to go next?
I am going next.
Okay. Yes, Dr. Fuki, she mentioned that you are possible to say everything in the notes. Yes, it is not possible to say everything in the notes, but at least you are going to be ready for the possible questions. As I said, these are the questions which I've gathered from the other candidates to make sure that the candidate who is going to read the note will be able to answer the question. Most probably you will not get all these questions, but at least you will be ready with them, particularly the DVLA and so on. Okay. If she is stubborn, we will notify the DVL. Yes. Okay, so who would like, yes, doctor, what is your station, doctor?
Vascular dementia.
Okay. Vascular dementia.
Management of vascular dementia.
Yeah. I'm ready whenever you're ready, doctor.
And what's the father's name?
Mr. Green.
Mr. Green. And the son?
Michael.
Okay, thank you.
Ready?
Yeah.
Okay. 1, 2, 3, go.
Hello, Michael.
Hello, doctor.
I'm called Dr. Kasigo. I'm one of the mental health doctors. So I can see from my notes that you have concerns regarding your father, Mr. Green.
Yes,
Is
yes,
that right?
doctor. Yeah, yeah. He became very forgetful, doctor, and he's more dependent on us, and we want to know exactly what's wrong with him and how we can help him.
Oh, I can see you're really concerned and regarding your father, but we're going to discuss possibilities of how we can help him. Okay.
Okay.
Maybe just to let you know, I have some results and some scans that have been done. Has anything been explained to you yet?
Yes. It will be helpful.
Yeah. So from the scan that has been done from your father, it seems he has what we call vascular dementia. I don't know if you've heard of that.
Now, what is this vascular dementia?
Yeah. So it seems so from the scan it seems the blood vessels are narrowed and they are damaged.
Yeah.
Yeah. So dementia. So vascular dementia is part of dementia. Dementia is specifically a condition which affects memory, function, and behavior. Okay. So vascular
Yes.
dementia is just part of dementia and it affects the blood vessels. So it can be damaged or blocked, and that can reduce blood supply to the brain, and that can cause memory problems. Okay.
Yes, doctor. So what would be the cause of vascular dementia?
Yeah, thank you so much for asking, Michael. So, Michael, maybe we can go through a little bit of some information, and then I can explain to you more what could be the cause of vascular dementia, if that's okay.
Okay.
Yeah. So, Michael, maybe is it possible to tell me more about what has been happening? Because you told me about the memory, and could you tell me about what has been happening at home?
Doctor is very forgetful, and he has changed a lot. He used to be very independent. Now he's very dependent and needs more assistance from my mother, which is also old. Most of the
Yeah.
time, all his children are working.
Oh dear. And apart from that, is he like able to? So you said he needs more assistance than he used to.
Yes.
And are you concerned about anything? Are you concerned about, apart from his memory, does he wander around?
Yes, he likes to go out and lately he gets lost in the neighborhood. And
Oh,
the only thing which brings him back is that the neighbors know him.
okay, I see. Has this been happening very frequently?
Well, actually, yes, lately, yeah.
Oh, I see. And apart from that, have you does he seem to does he smoke at all?
No.
And does he use any drugs or alcohol?
No.
Oh, I see. Do you know anything about his physical health that you can maybe let me know?
Yes, lately he had a stroke and he's on some medication called warfarin.
Okay. Okay. And is he remembering to take his medications very well? Is he remembering because of the memory
No.
problems?
He is dependent on my mother.
Oh, I see. And just to go back, does he mostly like get agitated and it becomes difficult to control his behaviors?
No.
Okay, that doesn't happen. Okay. And maybe just talk about his maybe um he, so you've talked about his physical health and you said he mostly takes warfarin, and anything else
Yeah.
that he takes that you know of?
No.
And does he drive at all?
No, we asked him to stop driving and he was cooperative.
He was cooperative.
Yeah.
Thank you so much for letting me know all this. So maybe just to get back to what you asked me of how we can maybe help him.
Yeah.
Do you want to know how we can help your father?
Yeah, sure. Yeah.
Yeah. So thank you so much for telling me all this. So from what I can see is your father has been having memory issues, and we've looked at the scan, you've looked at the blood, other bloods. I don't know if anyone has explained to you, all the bloods were all normal, and everything else is fine. He's been getting lost. That's a very high risk. And the good thing about driving, he's been having physical health issues, and he's not remembering to take his medication. Is that right?
Yeah.
So maybe what you can do, I don't know when was the last time he's had any like his blood pressure taken, or he's seen a GP.
Well, the GP says that his blood pressure and blood sugar are fine.
Yeah. Okay. And do you have any concerns at all? Do you have any other concerns before we go further?
No, I would like to know how I'm going to help him.
Oh, yeah, thank you. So the first thing I would like to know is, maybe the first thing to do is make an appointment and assess your father, okay?
Yeah.
And at least that I'll be able to thoroughly examine him, do a very good, maybe assess his risks, and maybe also explain to him the diagnosis really well, okay?
Yes.
And from what you told me right now, he's being cared
1 minute
for.
remaining.
He's being cared for by your grandmother, who is things are really difficult. Maybe at the moment we can try to do maybe some package of care to see if that will be helpful.
Okay.
Yeah. And before I go further, do you have any further concerns?
No, thank you.
Yeah. So maybe another thing we can do regarding the management, we can manage in 3 ways. So the first thing we can do is we can manage his medication. He's not taking his medication. He's not remembering to take his medication like a dosage box. And maybe we can try to make sure everything is controlled, his physical health, okay? And maybe we can also maybe involve something to like for agitation, like something about social services, to maybe help to see how we can help him better. Is that okay?
Yeah.
And anything else that you want to ask about your father?
No, thank you.
I'll try to see if I can give you maybe some leaflets.
Okay, time. How do you
No,
feel
I
about
was very anxious. I've never practiced in a big
you're
group.
very anxious. Very common to be anxious in the exam.
I was very anxious, I swear.
Okay. I wanted to give her some feedback. Colleague, very clever. By the way, most of the doctors are anxious. Maybe that's why you are keen to study, because we are afraid of the exams. So we study as hard as we can. And that's why we have a good exam record. But this anxiety is not helpful in this exam because there is a subjective impression. Okay, so I pay attention to what you are saying. When you explained the CT, you said that it showed that the blood vessels are narrowed. The CT does not show any blood vessels. It shows some areas which are necrotic or they are damaged because most probably the blood is not reaching them, but it does not show any blood vessels. The explanation can be better. What could be the cause of vascular dementia? You did not answer this question. You are using very long sentences and it was not very organized. Let's see how can we do this according to my as I said, it's you are not obliged to stick to my notes, but make sure that you use the mark sheet to make sure that you pass. Okay. Bismillah. So let's see. Your introduction was very good. You started by greeting the patient, identifying yourself, and explaining the reason of discussing the father's condition with this man. And you started by explaining the CT. Okay. And then you should explain what is the vascular dementia. Dementia is deterioration in the brain functions, particularly the memory, language, and functioning in the personality. Is called vascular because there are areas in the brain not receiving the blood as shown by the CT. Okay, so that's why it is vascular. What could be the cause? Most probably hypertension, diabetes. The scenario says that there is hypertension and diabetes and so on, but I did not say this because I wanted to give you time, because if I said them, you will elaborate and you were running out of time. In the real scenario, this man has a predisposition for this vascular issue, for the vascular dementia because of the hypertension and the diabetes. Is it common? Up to 20%. You will be asked, is it curable? You must be very, very empathetic when you deliver this information. Unfortunately, the dementia is a progressively deteriorating disorder. Okay, you must say unfortunately. Okay.
Yeah.
There's a progressively deteriorating disorder, and unfortunately, the lifetime span after the diagnosis is between 4 to 8 years. The medical support can only decrease the rate of deterioration and to improve the quality of life and to help the caregivers in taking care of the patient. So this is how you answer this question. You must be very accurate and honest in answering this question. Okay, a deteriorating disorder, the lifespan is only 4 to 8 years after the diagnosis, and the medical support can only decrease the rate of deterioration and improve the quality of life and help the caregivers in taking care of the patient. How can we help him? Very good that you started to ask to gather information in order to make sure that your plan is going to cover all his needs, but you would be very disorganized. So when you start to gather information from your patient or from the relative, put in your mind a plan. I want to gather the biopsychosocial information. So psychologically, is he depressed? Is he still interested in things which he likes to do? Okay, what about his sleep appetite? Just simple questions to understand whether he is depressed, okay, or confused. Very important to ask about the confusion. Okay, is he depressed or confused or psychotic? Because all this is going to be reflected in your management plan. Physically, okay, very important to ask about the medications. This man is supposed to be taking warfarin. He also has other medical problems, so you want to know exactly whether he's taking his medications. And very important, if he is having a vascular dementia in particular, I want you to show to your consultant that you are different from the other candidates. So if he is having a vascular dementia, very important to check whether his movement is okay or not. Because most probably this movement can be also affected by the vascular insults. It is a very common association in the vascular dementia that their movement also is affected. And the candidates do not know, if they have a clinical experience, they will know that it is a very common association. Very, very common. Okay, so if you have a vascular dementia because the vascular insults all over the brain, do you think it will spare the movement areas? No, definitely. The motor areas, definitely, there is a big chance that they are going to be affected. So you must check the movement. You asked about the social circumstances and who is taking care of him. Very good. And the risk, you ask about the risk. Very important to ask about it. If he is agitated, able to take care of himself. Falling, very important to ask about the falling and so on. So basically what we have done so far is that we explain, you start by the explanation of the diagnosis and the CT, yeah. And then we started to gather the biopsychosocial information, basically the basic information, but we have added just some questions related to the diagnosis. Here, the movement. Here's some risks related to the dementia, particularly getting lost and falling because of the movement. And then we do our formulation. So this man is having vascular dementia and there is risks towards himself if not managed properly. Very important. That's vascular dementia. The main psychological problem here is the vascular dementia, and there is risk if not managed properly. As we said in the formulation, the first line is the main psychological problem and the level of risk. Then the next line, the background information in the biopsychosocial areas. So all this in the background, that he has poorly controlled blood pressure and high blood sugar level. There is past history of psychiatric disorder. However, the level of care which he needs might not be available by his caregiver. So these are the biopsychosocial information. Are you with me so far?
Yeah.
So the management, as we said, when you reach the level of the management, most probably will have not more than 2 minutes or mostly 90 seconds. So you start by Dr. Sarah. What are you going to do and where the patient is going to be treated? You want to see your patient. Because he is having dementia, his mind is still intact. He has memory problems, but he can, if you have met a patient who have dementia, he can understand and you can discuss with him the management and everything. Okay, so you must explain the diagnosis, the management plan, and address his concerns. Okay, where he's going to be treated, he can be either treated at home and follow up in the memory clinic, or he can be treated in the hospital if he does not have the enough support he needs. Okay. Now, regarding the investigations, very important to make sure that his father is fit to take the treatment. You must double check his investigations because the main treatment here is to make sure that he's physically fit. The dementia, vascular dementia, is not going to find any help from the anti-dementia medications. So you must make sure that his liver functions, kidney functions, and blood chemistry and heart tracing are all okay. Okay?
Yeah.
So, and then finally, the team which will help him physically, psychologically, socially. Physically, you must liaise with the GP and the physician to explain the diagnosis, because the patient has vascular dementia. Is basically managed by optimizing his general medical condition. Okay, so you must make sure that that his medical condition is stable. Okay.
Yeah.
Particularly that he's taking warfarin. Now, he will ask you about the anti-dementia. Unfortunately, anti-dementia is not going to be helpful in this man. Psychologically, the medications, if he is, the depression is common. You must mention this. Okay, very important. I want you to say something different. There is something called vascular dementia. It's not here. Vascular depression, its place is not here, but it is not uncommon to have depression. So psychologically, if there is depression, you're going to manage it. Okay. There are some antidepressants which are not recommended, like the tricyclic antidepressants, which are not helpful because of the effect on the acetylcholine. Psychologically, there are psychological support which can improve the quality of life, like reminiscent therapy and other non-pharmacological support. Now, the social part of the management, you must mention that the social services will do caregiver assessment to make sure that the patient is getting the help which he needs, and they might arrange for the care package. And very important to mention the occupational therapist. Here, doctors, the occupational therapist is very important if there is any problem with the movement. And as I said, the vascular patients, their movement is awkward. To make sure that the home is safe for them. Okay, that's it. This is the management. I hope that you found it helpful, doctors.
Yeah,
I know
that
the management stations are not easy. The passing rate in the management task is not high, and I can feel the frustration which you all have, even though that I can see that you are experienced, but as I said, it needs practice. This exam needs practice, particularly the task of management. Thank you so much, doctor. Don't get frustrated from my feedback, okay?
No, thank you. Thank you so much.
I'll not go through the mark sheet again, please. I'm tired. So who would like to go next?
Can I go next, please?
So what is your station, doctor?
It's suicidal intention management.
Suicidal ideation.
Oh, ideation.
Suicidal ideation, not suicidal intent.
Can you see me? Can you all see me?
Yeah, I can see you.
Oh, sure.
Please read the station. This station, I hope that you all read it because it is a new station.
Yeah.
Because the passing rate is not high.
What is the name of the patient?
The same name is what? Kevin. My name is Kevin. Ready?
Yeah.
Okay, 1, 2, 3, go. 1, 2, 3, go.
Hello, Kevin. I'm Dr. Bhattrai. I'm one of the doctors working in the team. I'm a psychiatrist. I'm here to discuss about some of the difficult thoughts that you've been experiencing recently.
Yes, I've discussed this with my GP, and sometimes I have these thoughts that I want to end it all, doctor.
I can understand how difficult that must be for you. Can you tell me a bit more about how long you've been having these thoughts?
I just it has been about maybe 1 year, something like this. I cannot tell exactly.
Okay. And so can you tell me a bit more about what kind of thoughts you have?
Well, I just have this thought that, okay, like, what is the benefit of living and suffering? Why should I go through all this every day? And there is no benefit of just keeping on like this. Everything is repeated. There's nothing to do. Life is not worth living.
I'm sorry you feel that way, Kevin. I just want to know how things have been with your family life, for example.
Everything is nice. I cannot complain. Nothing has changed recently.
And do you know anything that might cause these kind of thoughts?
Nothing in particular. I've asked this question several times. Nothing.
Okay. And yeah, so, and have you actually, so when you have these thoughts, are these thoughts yeah, do you actually kind of go out and do something to harm yourself?
Well, no. I'm afraid that I might, might do anything. Just why I'm asking for help.
Okay. So from my understanding, you haven't actually done something to harm yourself, like cut
No,
yourself
no.
or take an overdose or
No.
Okay. So you actually described it as a fear, rather than a will to kind of wanting to do it. Is that correct?
But they keep coming, doctor.
Okay.
But when they come, I feel that they are very annoying. I stop
Yeah.
doing anything.
Yeah.
When I have
Okay.
these.
Do you try and resist them quite a bit?
I try, but this thought that, okay, you can take an overdose of paracetamol. It would be better to die instead of going through all this suffering again and again.
And what do you do to kind of, what do you do to deal with these thoughts?
I just avoid doing anything. I just stay at home. I don't want to take anything.
Okay. Just for my understanding, this question might sound a bit strange, but do you know these thoughts to be your own, or do you think this is?
Yeah, it's my own thoughts. Yeah.
Kevin, do you have anything other than this that you need to do repeatedly?
No.
No. So you don't need to wash repeatedly or check things are in order repeatedly, for example?
No.
Okay. Can I ask if you take any alcohol at all?
No.
Oh, any other medications that you're on?
No.
No. Have you ever tried any drugs?
No.
No. Okay, that's good. Yeah, so yeah, tell me, you talked about the thoughts, and how often do these thoughts come to you? And
well, they come, doctor. I can't tell you exactly when, but they come, and when they come, they are very annoying.
yeah,
They can come maybe every 2 to 6 weeks
okay.
and
And
last 4 to 5 days.
okay. But have you ever made a plan to kind of go through with these thoughts?
That's the main thought, that if I take an overdose of anything, it will be sufficient. I just want know. I just want to know what could be the solution for this.
Right. So you told me, you've been having these thoughts, but you haven't actually tried doing anything, and then you feel fine. How is your mood recently?
My mood is fine most of the time. Yeah.
Okay.
I don't have any depression.
And yeah, do you have things that make you feel good about your life?
Like what?
Any positives that you kind of look forward to?
Well, I have my work, and if I don't have this, yes, I feel that many things in my life are
Yeah.
but when I have these thoughts, I feel that life is not worth living.
Right. And Kevin, do you have anybody else in the family who has had these kind of thoughts?
No.
No, anybody that you know has.
1 minute remaining.
Okay. Yeah. So Kevin, has anything helped that you do by yourself? Have you?
No, I just want to end my life. That's it. And when this thought comes to me, I just feel that it is very strong.
I could read from my notes that you've seen quite a bit of psychiatrists, and you've tried medications. Have you tried anything psychological in terms of therapy?
No.
Would you like me to tell you about a therapy that might be helpful?
Be very helpful. Yeah.
Okay. So I think from what you're experiencing, I think there's something called DBT, or dialectical behavior therapy, that is known to be quite effective in dealing with these difficult thoughts. We can meet another time and go through this if that's something that you'd like to try.
Time. How do you feel about what you did?
Oh yeah, I missed quite a bit because it's
well,
the
actually,
management.
you managed the station as if it is a history
station,
and you did
I
not
couldn't.
talk about the management.
Yeah.
And actually, the management here is a bit different, and it took for me a long time to know exactly how to manage this particular issue which is raised, and you'll be surprised that the management can be a bit different from what is usual from the other. So I hope that you pay attention and take screenshots, or do whatever you would like to do to make sure that you don't miss this time. So you introduce yourself in a very good way, but as I said here in the task, taking talking about many management points, which is related to our plan, have been excluded, like the medications, the mental state. However, you should assess the suicidal thoughts, which you did, but it was very, very disorganized. Okay.
Yes, sir.
Can you tell me? So you must start by assessing these thoughts. Can you tell me more about these thoughts? Give me examples. Very important. Give me an example.
Yeah.
Anything makes them increase, what makes them decrease? When you have these thoughts, how do you cope with them? Very important. Okay. And then you continue by saying, do you feel that they are controlling you, or he is controlling them? Okay. Is he obedient? Does he have any plans? Very important, because thoughts are different from plans. Plans is another level of suicidality, which is serious. If someone is having suicidal thought, this is totally different from someone is having suicidal thoughts and plans.
Yeah.
And whether he has ever attempted to act upon them. Okay. And then ask about his social life circumstances. Simple. What about the life? Any stresses? Anyone around him to support him? Very important to ask about access to weapons. Okay.
Yeah.
With me?
Yeah.
Okay. So the first thing you do is to know exactly more information about these thoughts.
Yeah.
The examples, what makes them increase, what makes them decrease. When he has these thoughts, what does he do? How does he cope with them? Okay, whether these thoughts are controlling him. Does he have a particular plan? If he has ever attempted to act upon them, just having thoughts. Want to know more about his mood when he's having these thoughts. Socially, want to know about his life circumstances, anyone around him to support him, and if he has any access to weapons. Okay, very important to explain some factual information related to this serious issue.
Yeah.
Okay. So you have 9% of the population have suicidal ideation in their life. So 9% of the population at one stage of their life, they will have suicidal ideation. 60% of these ideas will turn into plans in the very first year. Therefore, it is important to set a help while having these thoughts. We don't want these thoughts to turn into plans. So these are two important factual information which will just put you in a different place from the other candidates. 9% of the population have suicidal ideation in one stage of their life. 60% of these ideas will turn into plans in the very first year. Very important to set a plan to help them. Another important factual information: suicidal is preventable, but is unpredictable. Okay. However, the good news is that interventions could save lives. Okay, very important to say this sentence. Suicidal is preventable, but it is unpredictable, and having a plan and intervention can save lives. Okay?
Yeah.
So, starting by talking about the management, very important to follow up regularly. So your patient must follow up regularly in your clinic. So this is the first thing you do. Doctor, I cannot, what is your name, dear, again?
Dr. Gaurav Bhattrai.
Oh, so Dr. Gaurav, so you must follow, you must say, I will follow up you regularly. If you have someone who's saying to you, I have thoughts of suicidality, definitely this is a patient which you need to see him more frequently to make sure that these thoughts are not turning into plans, as well as, so you must do your mental and physical risk assessment and so on. And if there is any serious risk, you must consider admission. Now, regarding the plan, pay attention to this, because this is different from whatever you're going to see in any other place. So regarding the plan, which can help you during these difficult moments, there are several points which you can work on to make sure that your life is safe. Getting through the moment when he is having these ideas. few things can help you for a minute or two to buy you some time to use the rest of your safety plan. For example, watch a favorite video. So once he is having this particular idea and this, there is an actual idea running now. So you must have a plan. So he's going to watch a particular video, must connect with someone who is good for someone good for him. Focus on breathing. Take a break by moving to another room or going for a walk. And in this place, it will be very helpful if we said that there could be a dialectic behavioral therapy. And this is part of the dialectic behavioral therapy, that there is some sort of calls whenever there is an emergency. But I prefer not to write here the dialectic behavioral therapy, because it gives an impression that this man is having a borderline personality disorder. I don't want to mix the methods with with the management. So want to focus on the suicidal ideation. So when he's having this idea, you want to get through the moment, okay? He must be in a safe situation. Always makes the situation around him safe. What can you do immediately to improve your safety? Is there a place to go to easily when to feel safer? What can you do in the longer time to improve your safety? If he is living alone, he should try to live with his family or with someone else. Okay? Ask him, can you remove anything you might use for hurting himself? So he says that he might do or take an overdose. So you must make sure that there is nothing in the place around him which can be used as an overdose. Okay? So the second thing is to make sure that always that he is in a safe place, safe circumstances, either with someone safe or very close to someone who can help him, and always away from anything which can be used as or an overdose. Okay.
Sure.
He must always have some sort of activities to lift his mood. Okay.
Yeah.
So this is some sort of behavioral therapy, behavioral activity, which it should be an ongoing activity to make sure that his mood is elevated and makes him stick to life more, like positive reminders, calming activities, and concentration activities like reading. Okay.
Yeah.
He must always know and practice distraction. Regular practicing of distraction will improve his ability to distract himself when he has these suicidal thoughts, by playing a musical instrument or going for a gentle walk or doing some stretches or breathing. So these are the 3 and 4 behavioral exercises to make sure that he is going to be able to cope with these ideas. Okay. You must give him a list of people, or he must make a list of people which can help him. Names of people to message or get in touch if he is in problem. Okay. And if he can have a professional help, either by a care coordinator, NHS helpline, or the GP. So these are the people which will help. Finally, I'll give you leaflets about all what we have discussed. And always in this particular station, terminate the station by saying the emergency contact numbers.
Yeah.
Okay.
All that was in my mind, but obviously I ran out of time.
Okay. As I said, these are different approaches to the problem in the station, which you will not find in anywhere else.
That's true. Actually, while I read the vignette, I thought, like when I saw the vignette initially, I thought, like distraction techniques and all this were in my mind.
Doctor, your approach to the station was mainly history taking.
History taking, I know.
Okay.
But there was a point in the vignette that said 10 years of intermittent thoughts.
Intermittent thoughts, yes. This is a thought. So he has thoughts without background mood
Yeah.
depression. Okay.
Yeah. It just
Okay.
Can I add in just one
Yes.
thing?
What is
So,
your question?
Yeah, I wanted to go through all this, but because it's 10 years of being with psychiatrist and taking medication, a
Doctor,
part
pay
of me.
attention. Please pay attention to the task. Pay attention. Please don't take history or examine his mental state or inquire about previous treatments.
Yeah. No, what I meant
Focus
to say is
on
like
the
with
suicidal thoughts. Focus on the suicidal thoughts.
yeah.
This is the ideal answer. If you want to add anything to it, it's up to you. But pay attention that there is a time limit. Okay.
Sure.
And I hope that you found it helpful. Thank you so much.
Yeah. Thank you.
Okay. So who would like to go next? Have we finished? Okay. Today's session was very important. It's always very important because, as you can see, totally new stations. I hope that you all focus on these stations because the passing rate in them is not high. Thank you so much. Hope that you found it helpful. Hope to see all your names in the pass list. Thank you.